Tonight, we're learning North Carolina Democratic lawmakers are now filing a new version of a maternal health care bill known as the Momnibus Act. It aims to improve the outcomes for expecting mothers, especially Black women. Julian Grace has more.
Charity Watkins and Gabrielle Scott both know firsthand about the disparities Black women face when it comes to medical care during and right after pregnancy.
I'm highly educated. I am able to advocate for myself, but yet was dismissed, and my symptoms could have easily resulted in me losing my life.
I was telling the nurses and the staff, hey, I know I'm in full-blown labor. I need some medication, please, for pain management. I actually was ignored.
State Senator Natalie Murdoch says those frightening stories are far too common.
The data shows us Black women continue to be 3 to 4 times more likely to die from childbirth, even with education.
That's why she and 2 of her colleagues in the State House have once again filed a maternal health care bill this session. Among other things, the bill would establish grants for community-based organizations, provide implicit bias training for maternal care professionals, and fund lactation consultant training programs at HBCUs. OBGYN Dr. Michelle Benoit Wilson says this is exactly the kind of legislation the state needs.
We need to stop using politics as a bouncing ball and as opposed to recognizing the core problem, which is that women are dying and they shouldn't be.
The bill is once again unlikely to pass this session. That's something one of his House sponsors, Representative Julie Von Hafen, understands. But she says the messaging is still important.
Even if we can't get the bill passed in the General Assembly right now, we need to build the momentum so that, when we finally are in a position to get some of these things passed, we have the advocates, we have the outside strategy in place, and we're ready to go when we're able to pass it.